Guys, welcome back to my channel. In this video we are going to talk about mastitis, breast cancer, abscess, celiac disease, botulism, congenital hypothyroidism and hypothyroidism. They are short topics but we might miss some points sometimes, so it will be very short video, and we are going to highlight only the main points according to the croc examiner point of view. So let's start. Here comes mastitis. First of all, let's define it. Mastitis is the inflammation of breast tissue which is often caused by any infection. Most commonly affects the breastfeeding woman, which will result in pain, swelling, redness, warmth in the breast. Typically occurs when the milk is trapped in the breast. When the milk is trapped inside the breast, it will lead to the bacterial growth. So simply the inflammation of the breast tissue. So let's go to the question directly because it's the simple topic. So the woman, first patient, the woman, 14th day after the labor, sudden pain, hyperemia and induration of the left mammary gland, pain on palpation, pathology, headache, body temperature is up to 39, it is high fever, indisposition, fissures, nipple enlargement of mammary gland, and lactostasis. So lactostasis is milk flow, obstructed milk flow. In position means she is feeling uncomfortable. Lymph nodes of the axillary area are enlarged. So the question didn't really say about anything like cancer or anything. So this is simply the inflammation of the breast tissue. So we are going with the lactational mastitis. Next patient also complains about fever, chills, weakness, hyperemia, enlargement of the breast, pain, deformity on the mammary gland on palpation. The infiltrate was found to have a softening and fluctuation. So it indicates the abscess. So as this softening and fluctuation, due to this we know that there is the abscess over there. There is a presence of abscess over there. So we are going to mark purulent mastitis this time. So infiltrative purulent mastitis. Next is 30-year-old patient reports the same profile about the mastitis, but it says a sharply painful infiltrate without clear borders. So when it says about the sharply painful infiltrate, so it's the inflammation of the infiltrate. So it's infiltrative mastitis. Also the inflammation of the breast tissue. Next, first let's read about breast cancer, what it is. Breast cancer we have talked about in tumor as well, in tumor portion. You can watch the video about tumors very well. However, I find it important to include some questions here as well. So breast cancer is the malignant tumor that develops from the breast tissue. So symptoms can be a lump or mass in the breast, in the underarm area, changes in the breast shape or size. The main thing, let's go to the main thing, the nipple discharge other than milk, or blood stained. They can be blood stained, or the main thing is about nipple retraction. And another thing the question highlights is lemon peel here. So a lemon peel also, as you have seen the skin of the lemon is a bit rough type of skin, dotted or pitted type of thing. So this 50-year-old patient complains about the tumor of the right mammary gland, which is up to 5 cm without distinct outlines. Skin over the tumor look like lemon peel. Palpation reveals a lymph node in the axillary area, so enlarged lymph nodes. So it is breast cancer. Simply lemon peel is also a highlighting point for the breast cancer. So another patient says that she went for the preventive checkup. So in the examination, no lump in the breast or organ in the lesser pelvis are within the age of norm. Her cervical cystology results are normal. And which advice can be given to her? So her mother died due to breast cancer, and younger sister is suffering from the mastopathy. So the main thing the examiner want to highlight here is that the patient is having the history of the breast cancer. Even her mother died out of breast cancer. Her sister is also suffering from breast cancer right now. So in the genetic of this family, she is prone to breast cancer. So what can we advise to her? We can advise her that undergo a mammogram once a year, so that if there is any breast cancer is there, so the early diagnostic can be made, and hence the good treatment. So these two questions you will see in the tumor portion also I have covered, but so just to be sure that I'll not let you forget these two things, because I have marked them wrong again and again. So we will see the question once again. So a female self-detected a tumor which is painless, firm, mobile, dense, and ultrasound shows massive neoplasm, this and this size. So we mark the diagnosis fibroadenoma. This is the tumor of the mammary gland, hard, immobile, irregular. Another question also I have included here, that if you see the symptoms of breast related symptoms, breast cancer related symptoms, or breast pain, increases one day before the menstruation and stops after the menstruation. So do not have to mark the premenstrual syndrome for this one. This is fibrocystic mastopathy. Next is abscess. Abscess is a localized collection of pus that forms in a tissue, organ, or a space in the body as a result of infection. So it occurs as a result of body's immune system as an attempt to fight for the infection, which will lead to the accumulation of RBC, induration, bacteria, dead tissue. A lot of cases will be there. So acute abscess is less than 6 weeks. After more than 6 weeks, it will be chronic. However, this data keeps on changing all the time, but just to remember. Characters, what we will see: pain, redness, swelling, fluctuation, fever. Let's see the questions. So 3-year-old girl having fever, difficulty in breathing through the nose, mouth, hyperemia and large tonsils, and bulging of the posterior pharyngeal wall. Why the posterior pharyngeal wall has got bulged? Because of the abscess. So the girl shows the profile of fever, the hyperemia and large tonsils. So they are the symptoms of abscess. So we will mark a retropharyngeal abscess, that when the area where the posterior pharyngeal wall is there, so just below that the abscess is there. That's why the posterior wall has bulged out. Let's go to the next patient. Next patient says that a 36-year-old headache, obstructed nasal breathing, purulent nasal discharges, and the presence of thick pus following the dental work. So filling of maxillary premolar. The patient went for the filling of the maxillary premolar. So now what the patient is having: intense opacity of the maxillary sinus. Diagnostic puncture revealed a large amount of thick pus over there. Month before he had a right maxillary premolar filled, as it is the question is just repeating itself. Diagnostic puncture yielded a large amount of thick, foul smelling granulated pus. So now the question is asking about the diagnosis of it. So since it is marking about the history of 1 month, so it is chronic already. So another thing is suppurative, because the pus got revealed. Odontogenic, because the pus is the result of the filling of the premolar this time. And sinusitis, because they mention about the inflammation of the sinus. So mark the answer: chronic, suppurative, odontogenic, sinusitis. There is a question about it. So next is the similar patient got extraction of the second molar tooth, and after that the patient got these symptoms: infiltration, hyperemia of the lower part of the palatine, anterior palatine, displacement of the tonsils toward the midline, upward. Regional lymph nodes are painful on palpation. So the examiner is saying that he is diagnosed with the paratonsillar abscess. So what was the route of infection spread? So since he got the extraction of the second molar, so it is odontogenic. The spread has occurred through the teeth removal, right? So this is why we mark the answer odontogenic. Next is celiac disease. Celiac disease is an autoimmune disorder which is triggered by ingestion of gluten. This is the main important thing which we are going to see. You can read all the text also. So let's see semolina. Semolina is a type of wheat flour which is made up. Semolina is a type of flour which is made up of wheat. Ataxia, we know the problem with the coordination. I have explained it before in some videos. Let's say It primarily affects the small intestine and lead to the inflammation of the damage to the intestinal line, which impairs the nutrient absorption. Let's see some questions, you will understand it. First of all, features will be changes with the bowel habits, abdominal pain, weight loss, digestive system, abdominal symptom will be there, and anemia, skin rash, bone joint pain. No need to remember all of these points, because the question will highlight semolina word very well. So here is a case of a 2-year-old boy who got semolina introduction in his diet. So after that he got this and this symptoms, so mark the celiac disease. And another boy is there, question number 2, that loss of previously learned skills, loss of mass, loss of appetite, anorexia. So a lot of things are there. Foul smelling, skin is pale and dry, hair are brittle, distended abdomen, limbs are thin. Stool test shows high level of fatty acid. High level of fatty acid when got released in the stools, it means there is a problem with the digestion. So sometimes we see in the cases of pancreatitis, steatorrhea and catatoria, the same thing, the loss of fatty acid through the stool. Remember the symptoms, that the memory loss is bowel movement together with some neuro symptoms is a feature of celiac disease. That diarrhea, abdominal pain, weight loss, they are bowel movement changes, and the absorption system changes. So together with these, because celiac disease is a autoimmune disorder, so we'll see neurological symptoms as well as reproductive issues as well. So the disease is serious, seems to be normal, but disease is serious. So this is how this boy got loss of previously learned skills. So copious is the large volume of stool due to low absorption. So the things whichever he is eating are unable to get absorbed in his gut or intestine. So mark the answer as celiac disease. Next is botulism. Botulism is rare but serious illness caused by the toxins produced by the bacterium, Corynebacterium botulism. So it affects the nervous system and can lead to paralysis. So if we understand the symptoms just one time, so we will not mark it incorrect. So there can be a lot of type of botulism: food-borne wound botulism, infant botulism, and inhalational botulism. You can read the description of them. Symptoms are here: diplopia, double vision, muscle weakness, paralysis, difficulty in breathing, since the botulism also affects the respiratory system. Problem with the speaking, swallowing, when the nervous system is affected, so all the system will get affected very easily, like the paralysis of pharynx. Eyes are something which will get affected like very fast. So difficulty breathing, swallowing, blurred vision, drooping eyelid, dry mouth, paralysis of pharynx, nausea, vomiting are everywhere. In food-borne cases, hoarse voice, this is something typical, important typical symptom, hoarse voice. So voice symptoms is also there in botulism, we have to remember that. So in the food-borne, look at this point. In the food-borne, I have highlighted something. The patient usually will eat canned food. So canned food will be given in the crock questions most of the time, the canned food. And one question is directly there which I haven't included in the video, but I'll tell you about it, that the patient ate some homemade fish in some crock question of test center. So the patient ate some homemade fish. So consider it that they would have, since the fish smelled so badly, so they would have stored it in some sort of airtight container, or let's say canned container, so that it doesn't smell before they start to eat it. So remember this, remember the thing about fish which I have just mentioned. Let's go to the question, you will understand it very well, you won't mark it incorrect. So the first patient itself says about the double vision. So what he do, heavy breathing. A day before, he ate homemade mushrooms. So he ate homemade mushrooms. His examination says pupils, something problem with the widened pupils, disorders of swallowing, bradycardia, constipation, difficult deglutination, myadrid pupil, which is abnormally dilated or enlarged pupil. So these all are the symptoms of botulism. uh, if I'm too fast, just you can just pause the video and read the question well. I have explained everything very well in the written way as well. Next patient states that nausea, abdominal discomfort, single vomiting, dry mouth, increased general weakness, double vision. Double vision, we got what we needed. Difficulty swallowing, this is also difficulty swallowing of solid food, also typical for brucellosis. Botulism. Ptosis, drooping of eyelid, we got anisocoria, unequal pupil. Since the problem is with the nervous system, the neural system got affected. So first of all, eyes are going to affect very well, so very soon, because very small muscles of eyes cannot handle even a simple or mild neurodegeneration or some sort of disturbance with the CNS. They won't be able to handle. So the patient what he did a day before, or he ate canned feed. So in the evening, patient had dinner with the canned food and alcohol. Alcohol he can have, but he couldn't have the canned food, so he got botulism now. Next patient complains about similar complaints: nausea, vomiting, muscular hypotonia, low muscle tones, like he feel a bit of weakness, anisocoria. Also, he ate the canned food, as we know. We got diplopia in the question. Tick was detected on the skin. Nothing to do with this tick. This is just a distraction for the question. Disturbed swallowing and respiration, botulism. So hope you won't mark it wrong. Here is something written. Dysarthria is speech disorder which is caused by weakened or impaired muscle use for the speaking. And another patient, what he did is he ate smoked fish. So all of them are playing with their health simply. He ate mushroom also, mayonnaise also. 6 hours later he need the doctor now. Progressive weakness, vision impairment, fog in the eye. So eye problem will be must in the botulism cases, because having very small muscle in the eye, so mild disturbances with the neural system will first of all cause the drooping eyelid and blah blah things which we are seeing in the questions. Fever can occur. The patient is adynamic, may answer the question sluggishly, delayed response. So people are dilated with reduced response to fight. So Hoer's voice, I told you something typical for botulism. Oral mucosa is dry, so mark the botulism for that. Next is congenital hypothyroidism. Let's see what it is. So in congenital hypothyroidism, what happens is the baby is born with absent thyroid gland, which will result in decreased production of the hormones. Since it is hypothyroidism, so will be decreased production of the thyroid hormones, which are essential for the growth, brain development and metabolism. So symptoms, let's have a look over the symptoms very well. My friends have did it wrong very well. They did it wrong some 3-4 times. So even me. Symptoms, let's remember some of the main symptoms from it. All the symptoms are prolonged jaundice, hoarse cry, umbilical hernia, poor feeding, weight gain because hypo is inversely proportional to weight gain. Like if hyperthyroidism is there, then there will be weight loss. If hypothyroidism is there, there will be weight gain. Large fontanelle, constipation, dry skin, puffy face, swollen tongue, delayed growth and development. So the main thing to remember to solve the croc question, which we were doing wrong, me and my friends, it's the hoarse cry and umbilical hernia and some more of the things which you can remember if you want. Let's see the question. This is the question we marked wrong. So 2-month-old born with the weight gain of 5100. We already see it that 5 kg newborn is not normal at all. Up to 3 is okay, up to even after 3.5 is okay, but 5 kg is not okay. A baby has jaundice, hoarse cry, umbilical hernia. So we got what we needed. Delayed physical development, and the umbilical cord separation is also delayed, and you can have a look over the CBC changes. But the main thing here to understand is the symptoms of hypothyroidism. Congenital hypothyroidism is hoarse cry, umbilical hernia, jaundice, and delayed umbilical cord separation. So mark congenital hypothyroidism for that. Next is the hypothyroidism in the adults. So hypothyroidism, the definition remains a bit similar. Hypothyroidism means the patient will be suffering from weight gain. So it's the condition where the thyroid gland doesn't produce enough thyroid hormones, which are crucial for the regulation of the metabolism. Symptoms, what we will see: fatigue, weight gain, cold intolerance, dry skin, hair thinning, hair loss, or depression, mood changes. When the thyroid hormones are not enough in the body or in the blood, then a patient doesn't feel good. He feels some sort of depression, mood changes, constipation, muscle weakness, irregular menstrual cycle, swollen face or puffy eyes. Let's move to the questions. The question says, 39-year-old patient complains of the rapid fatigability, drowsiness, dry skin, hair loss. Hair loss is something typical, we know, but there is another things to mark the answer. So a swelling of the face month ago. The question gives the history for the thyrotoxicosis. So the surgeons did the surgery for the thyrotoxicosis, which means the severely enlarged thyroid gland, which means severe hyperthyroidism. So when the doctor was cutting that thyroid gland, he cut it too much. So after that surgery, there is gland dysfunction. The question is asking about the which gland got dysfunction. So we know that it is due to hypothyroidism. The surgeon cut the bigger part of the thyroid gland. So now the thyroid gland is very small in the size that it is unable to produce the enough amount of thyroid hormones. So now the diagnosis will be hypothyroidism due to inadequate operative technique. So the surgeon cut the thyroid gland more than required. Let's move to the next patient. Next patient says about the weight gain. We should be already thinking about the hypothyroidism, edema, dry skin, xeroderma, strong desire to sleep, somnolence. So difficulty with the focusing, height is this, weight is this. So he got the fever. So let's move to the main point. Main point is a thyroid gland cannot be palpated. Milk secretion from the mammary gland is observed. Increased TSH. Thyroid gland cannot be palpated. It means it might be very small by this time. So TSH and prolactin. So if TSH responds, who secretes TSH? Pituitary secretes the thyroid stimulating hormone, and prolactin is also secreted by pituitary. So the examiner wants to highlight the thing that there is no problem with the pituitary gland. And decreased level of thyroxine. So decreased level of thyroxine means where is the problem? The problem is with the thyroid gland. So never mark secondary hypothyroidism for this. I know you understand that it is hypothyroidism, but the question will give you secondary hypothyroidism as well. But the pituitary response is present, so there is no problem with the pituitary gland. The decreased level of thyroxine, which is the problem of thyroid gland. So it is primary hypothyroidism. Also, they say the cause of obesity. Because of the primary hypothyroidism, the patient keeps on putting weight on and on. So he got fatty, he got obese. The cause of obesity is primary hypothyroidism. Next patient says that next patient also underwent for the partial thyroidectomy due to the multinodular goiter. Now she complains of general weakness, drowsiness, constant fatigue, low work ability, constipation, edema on her face and limbs, dry and wrinkled skin, hair loss. So all of these symptoms are given in the question. Try to remember some of the symptoms, like hair loss is the symptom of hypothyroidism, weakness, irregular menstrual cycle. So this is what the patient is complaining about exactly. So amenorrhea, menstrual changes has given in the question. So mark the primary hypothyroidism. This is it with this video. I hope you are enjoying the videos. Let me know in the comments if you see any atypical question over these topics, and let me know your more mistakes. So wait for another video. More content is loading. Thank you. Have a good evening.